Well, March is known as Colon Cancer Awareness Month, and joining us today from Mercy Health St. Rita's, we have Dr. Sheena Patel, and thanks for joining us, Doctor.
Thanks for having me.
Okay, so first of all, sure, we focus on it in March, but why should we focus on colon cancer more than that, just beyond March?
So colon cancer is the second deadliest cancer, the third most common cancer in both men and women. Unlike most other cancers, colon cancer is preventable with screening and is highly treatable when detected early.
So are there certain age groups or certain people who are more at risk for colon cancer?
Sure. Anyone that has a personal history or a family history of colon cancer or polyps, colon polyps, anyone that has a personal history or a family history anyone that has a personal history of inflammatory bowel disease, specifically Crohn's or ulcerative colitis, and then also having an inherited genetic condition such as Lynch or familial adenomatous polyposis syndrome is at increased risk.
I understand too that even folks in the Black community, that they're at higher risk sometimes.
Sure. So African Americans are 20% more likely to get colorectal cancer and about 40% more likely to actually die from colon cancer. They're diagnosed at an earlier age and more advanced when they are diagnosed. And this is complex in why they're at increased risk. This can be related to diet, genetics, and lifestyle, but also they also have decreased likelihood to get screened as well.
Okay, so to make sure you don't have polyps, to make sure you're healthy, I take it the colonoscopy is the best tool, because I mean you hear about at-home testing and things like that, but what's the recommended standard, do you think?
So the gold standard, meaning the best for diagnosis, is colonoscopy. The reason why is if we find an abnormal tissue growth, we're able to remove the growth, thereby reducing your risk of colon cancer.
Okay, so what's the age that people should start having a colonoscopy, would you recommend?
That's very important. I'm glad that you brought that up. So the age previously was actually 50, and recently that has changed to 45, since we're seeing an increase in colon cancer in the younger age population.
Okay, so don't shy away from this. This is one of those areas where I feel like people are kind of iffy. They're like, I don't know if I really want to do it, but don't shy away, because if you catch it early, like you said, in the polyp form, that's the best thing.
Yep, and it's preventable. It's preventable, and you can treat it if it's caught early.
All right, some good advice thinking about colon cancer beyond the month of March. Dr. Patel, thanks for joining us today.
Thanks for having me.
All right, don't go away. New Edition continues in a moment.